कैंसर. ओके, कैंसर से कितने लोग मरते हैं ये 2 देशों में. एग्जाम्पल, उन्होंने देखा 1% भी नहीं है, 1% भी ये कैंसर से नहीं मरते हैं, दूसरे रोगों से मर सकते हैं. लेकिन क्यों ऐसा? उन्होंने पता लगाया हमारा गैनोडर्मा RGGL, उसमें एक्चुअली RG में मेडिसिनल पार्ट्स है, नेचुरल प्रिवेंशन के लिए, लाइक वैक्सीन. GL में ये कैंसर उत्पत्ति दबाने का शक्ति है. इट विल जस्ट, that's the reason not even 1% of the population die because of cancer. Because of these 2 reasons, they took scientists in 40 countries of the world, different cases. Then they found out and proved, even Indian scientists also, okay? And they told it is because more action of GL, Ganothelium, the root-like structure, because it has not to encourage this one cancer cells to grow. Okay, it is a fiber, so like that. And now also you see, we have got our RGGL combination product called Mycovita powder, okay, in which 2/3 of the powder is RG, microprocessed, cold compressed by nanotechnology, and GL is 2/3, RG 1/3, because it is prevention like vaccination of any disease, immunity. But GL is very important towards cancer. But nowadays, everywhere in the world market, they add preservatives, they add coloring agents, they write one, they put one. Now, you know what is the rate of cancer? One day, you just observe a cancer hospital. Simply sit there. You observe, if there are 3 deaths, 1 is due to cancer. 1 is due to cancer. Why so many people die of cancer? It is not one type of cancer. There are 200 types of cancer, because our body has 200 types of cells, starting from skin to neuro to heart to bone to, like building. It is a structural material. Okay, so we cannot just say that it's a blood cancer. Yes, it may be, but another person may get neurocancer. So cancer is widespread. GL is very helpful, especially for children growth of the brain and eyes and liver. So these are all some of the latest highlights. And one warning. They have told after corona experiments, this corona now for the time settled. It came and gone, maybe little damage, 10 days fever, leave that. But it leaves long footsteps, 10 years, damaging whole system. Like diabetes, it will shoot up. It was maintainable. But after it comes and goes, maybe 3 months, 2 months, 5 months, unnecessarily, unreasonably, their system is same. You know, they die due to diabetes complication, either kidney or liver, like that. In the next 10 years, more people will die. And kidney is already damaged, 60%, I told you, in diabetic after 10 years. Eyes, nerves, blood vessels, heart. But luckily, God is so kind. Not only Ganoderma lucidum, he also pointed out towards Himalayas and all mountains where our cordyceps grows. Cordyceps, actually, it was both delayed to leave to the market, especially Indian, not even now properly introduced, they are doing it now. Okay, here and all it is. So it has got its effect. If Lindsay has effect on 2 systems, this has effect on all the 6 systems. Heart, cardiovascular, nervous, liver, kidney, mind. Okay? That is the best one if you can afford. Not much money, life is not that cheap. 1 kilo powder of cordyceps costs 6.5 lakhs Indian rupees. In that for coffee they put 2%. One, otherwise tablets, capsules, liquid also now going to come. But Lindsay is 2 lakhs only. Because this can be grown more. That is you have to go and pick up. And then nanotechnology, greenhouse method, So we are lucky to know that. Okay. We are very lucky to know these facts. Still more are going to come. So, finally, I tell you about DXN. What is DXN? Dynamic Excellent Nutrition. Okay, DXN. It is very dynamic. The moment you take it starts working, you believe me. It is just like you are putting your foot on your vehicle brake. Vehicle should stop. Okay, like that it is a good brake. Not good means not 24 hours. It may take 10 days, 15 days. And moreover, news for my colleagues, doctors, some person gets fever. बुखार आता है, ओके बुखार आता है, लेकिन 20 दिन रहता है, 1 महीने रहता है, टेस्टिंग करवाया तो वो टीबी नहीं, टाइफाइड नहीं और इन्फेक्शन नहीं है, इधर का किडनी का इन्फेक्शन कुछ भी नहीं है, बुखार है. That is maybe I am telling, it is the reaction of chasing away the corona type virus out of the body and its toxins. Okay, so for that they have found out in Singapore and Indonesia, every day research is going on. And I am lucky to have my upline Dr. Clarence Stanislas, who is my classmate. And after 25 years he came with Ganoderma. And he showed me this is a very good, and he represented World Mushroom Biology Council 2 times. And he is more a scientist than a networker. Okay, I help him in network. Money is doesn't. 6 children are doctors. Okay, but this along with Dr. Lim, they are actually together in ideas changing everything. So that. They have found out the latest news. Latest means 6 months old. Singapore scientists, doctors, pharmaceutical professors, they have sent the message across scientists too. If your patient doesn't get their fever settled even after 1 month, and you test for TB, typhoid, malaria, anything on this earth, lab all the tests, it is not coming positive and the fever doesn't settle, you give 20 to 30 RGGL capsules every day for such patients and observe. Within 15 to 20 days, they will be normal. That is immune system, our body immune system. Small example, when Corona came also, one family, there are 5 people, adults. 3 people, DXN, they are taking products. 2 people not willing to take. The people who didn't take this, they got very severe complication. The people who were taking DXN products, starting from coffee, all these things, they came out of that problem. That is called PUO, pyrexia of unknown origin. All the tests in the world done, nothing coming positive, and neither fever is leaving that patient. what a stress it will be. Okay, and according to their advice, some of the doctors advise, no problem, you add RGGL 15, 20, likely, it is not overdose. In Australia and all, for any cancer, they give 100 capsules. We have seen, we were there long back. So, it does work. But the thing is, we can't show how it works. I treat, God heals. Body is the best doctor. That's what the dictum of our beloved Dr. Lim Eugene. Believe that and use this. Thank you all. Wish you all a very good and happy and healthy life. No stress. If you add on stress a little, the stress will become mountain. No drug for that. Okay? Thank you.
Thank you so much, doctor. That was a wonderful information in a short time. Do you have any questions? Do you have any questions? डाउट है? प्रोडक्ट के बारे में डाउट है? शायद वो लास्ट सेशन नहीं चाहिए हमको, Q&A सेशन नहीं चाहिए, किसी को भी डाउट नहीं, किसी को भी क्वेश्चंस नहीं, डाउट है आपको? जो जो क्वेश्चंस है, जैसा मुनीर भाई ने पूछा, आपने वो पेपर में लिखो और लास्ट में वो Q&A सेशन में अब हम वो क्वेश्चंस का आंसर करूंगा, डॉक्टर मैं नहीं, डॉक्टर लोग आंसर